Hey everybody. So this is the second podcast in the Sociology of Health and Illness series of podcasts. And if you remember last time we talked about the origins of medicalization and the factors that drove medicalization throughout most of history. Today we're going to be talking about medicalization in the modern era and what are considered to be the new drivers of medicalization. Early on, increasing medicalization, or the expansion of medical definitions and treatments, was driven largely by physicians' quest for power, professional dominance, and control over medical training and practice. Okay, so all of this was taking place through about the 1970s or 80s, okay? And medical sociologists have argued that there have been major changes in the drivers of medicalization since about 1980. Okay, so in 1980 we begin to see some very profound changes in the organization of medicine, and these have had really important consequences for the structure of healthcare and for medicalization as a process. And we'll talk more about this healthcare stuff later in the semester. But the big things are that there was an erosion of medical authority, and health policy began to shift from concerns about who had access to care, right? So it was more about opening the system up so that more people could have access to health care, and it shifted to more of a cost control narrative, right? And managed care, or different ways of reducing and managing the types of healthcare that people could get, became central. So there were all these attempts at cost control. Medicine became more corporatized rather than driven by individual practitioners. And this really changed the organization of medical care. So what was called the golden age of doctoring, right, where physicians operated really autonomously. They had a private relationship with their patients. All of that really began to change. And an increasingly buyer-driven system was emerging. And although physicians have maintained some aspects of their dominance, other players have become more important as well. So, for example, large numbers of patients are beginning to act more like consumers. So both in doing things like choosing health insurance policies and in seeking out specific medical services or medical information via the internet or whatever. So patients are increasingly being seen by pharmaceutical companies, managed care organizations, and even some kinds of physicians as consumers or potential markets for goods. Okay, so against this sort of broad backdrop of the changing organization of healthcare, Peter Conrad argues that there has been a big shift in the drivers of medicalization. And so now the three major drivers, he argues, are biotechnology, consumers, and managed care. So I'll talk about each one of these for just a couple minutes. So various forms of biotechnology have been associated with medicalization since the beginning of this theory. So technologies like forceps for childbirth or drugs for ADHD have facilitated medicalization since the beginning of medicalization. But until recently, these drugs and technologies were not the driving force in medicalization processes. They might have facilitated it, but they weren't primary. But Conrad argues that this is changing and that the pharmaceutical and biotechnology industries are becoming major players in medicalization. So although drug companies have always been influential, it always tended to be physicians who were at the center of medicalization issues. And even though physicians are still the gatekeepers for lots of drugs, the pharmaceutical companies have become a major player in this in the post-Prozac world. So the pharmaceutical industry has been very aggressively promoting its wares to physicians and especially to the public. Some of this is not new. So for most of the 20th century, However, the drug companies had been limited to promoting their drugs to physicians through sponsoring medical events and advertising in professional medical journals. However, in 1997, the Food and Drug Administration Modernization Act was passed, and the situation just completely flipped on its head. So the big change is that revisions in FDA regulations allowed for a much wider use and promotion of off-label uses of drugs. So what this means is that you can now use drugs in ways that have not been tested by the FDA and which have not necessarily been proven for whatever it is you're interested in using it for. In addition, the FDA regulations facilitated what's called direct-to-consumer advertising, especially on television. So, hence all these commercials for Viagra or other prescription drugs. So, part of the FDA rationale for this was that drug advertising would be educational and awareness raising for the public. So, it was part of this effort to give the public more power in their relationship with doctors. And again, this fits with this idea of the public as consumers. But this change in regulation totally altered the game for the pharmaceutical industry. So they can now advertise directly to the public and essentially create markets for their products. So for example, the pharmaceutical industry spending on television advertising increased sixfold between 1996 and 2000. And now it's at about $2.5 billion. And it's been rising steadily since then. In 2004, the industry spent $4 billion on direct-to-consumer advertising, most of it on television. And drug companies spend nearly as much on advertising now as they do in advertising to physicians and medical journals, especially for blockbuster drugs that are prescribed for more common complaints like allergies or heartburn or arthritis, erectile dysfunction. Things that make lots of money, and things which have sort of loose boundaries. Recently, a Kaiser Family Foundation study showed that for every dollar invested in direct-to-consumer advertising by drug companies, the companies get about $4.20 in sales as a result. So at this point, drug companies have a very vested interest in medicalizing, right? In doing things like taking what are mild or really normal life experiences and making you think that you need a drug for them. So again, pharmaceutical industry, a big driver now of medicalization. The other big driver that Conrad discusses is consumers. In our changing medical system, consumers of healthcare have become major players. So as healthcare becomes more and more commodified and subject to market forces, medical care has become more like any other product or service that you can buy. So we choose health insurance plans. We now purchase healthcare on the marketplace. We select where we want to get our healthcare from. And hospitals and healthcare institutions now compete for patients as consumers. So now consumers can drive medicalization through their demand for various products. Adult ADHD is a really good example of this. So ADHD had been around since the early 70s, but in the 1990s, a new phenomenon emerged, and that was adult ADHD. And so you saw lots of parents coming to physicians asking to be evaluated for ADHD and saying, my child is just like I was when I was little. You know, I have ADHD. I'm having trouble concentrating at work. I can't get my life organized. Must have ADHD. So Ritalin for adult attention problems is an off-label use of the medication. So drug companies cannot directly advertise either adult ADHD as a disorder or its treatment. But there are other ways to publicize the disorder, right? Like through internet websites describing adult ADHD and its treatment. And so there's this big advocacy group called CHAD, Children and Adults with Attention Deficit Hyperactivity Disorder, and it has become a really strong advocate for identifying and treating adult ADHD. So interestingly, CHAD gets the majority of its funding from the drug industry. So CHAD is a consumer-oriented group, And it, along with adults seeking ADHD treatment, have become a major force in the medicalization of what Peter Conrad calls underperformance. So in addition to individuals and advocacy groups pushing for medicalization and the expansion of treatments, the internet has become a really important consumer vehicle. So on the one hand, almost all drug companies and most advocacy groups have websites that have consumer-oriented information. These often include these self-administered screening tests to help people decide whether they might have a particular disorder or whether they might benefit from some drug or medical treatment. And then in addition, there are thousands and thousands of bulletin boards, chat rooms, web pages where people can share information about illness, treatments, complaints they're having, good and bad services they've received. And so for many people, this has transformed illness from a private experience to a more public one. So on these websites, people who have similar illnesses can connect and share information in new ways, which then empowers them as consumers of medical care. So this gives them, again, more power to demand certain services, and it allows for the dissemination of medical perspectives even beyond professional or even national boundaries. Okay, and so the third major driver of medicalization in the current era is managed care. So over the past 2 decades, managed care organizations, so these are things like HMOs, have come to dominate the healthcare industry in the United States, largely in response to healthcare costs, right? So the idea is that you can dole out care more equitably and more effectively and keep costs down at the same time. So managed care requires pre-approvals for lots of medical treatment. It sets limits on some types of care. But it also has built into it a preference for certain types of care over others. And so in some cases, this can drive medicalization. Managed care, in a lot of ways, has ended up commercializing medicine and encouraging medical care organizations and doctors to emphasize profits over patient care. This is a very complex issue, and we'll talk about this a lot later. But in some cases, it can provide incentives for more profitable care or disincentives for care that is less profitable. A good example is what managed care has done in psychiatry. So under managed care, until recently with passage of Obamacare, managed care had severely reduced the amount of coverage, insurance coverage, for psychotherapy, for inpatient care, hospital beds for mental illness, emergency room visits. All that has been reduced, but it's been a lot more liberal with paying for psychiatric medications. So managed care has become a huge factor in the increasing use of psychotropic medications for adults and kids rather than psychotherapy or cognitive behavioral therapy or other things that take more time and cost more money, but in some cases are more or just as effective as drugs. Additionally, and sort of similarly to this, physicians tend to prescribe drugs and also make diagnoses on the basis of what types of interventions and what types of disorders are covered under managed care plans. So this effectively accelerates drug treatments and also pushes certain kinds of diagnoses over others. Really, it pushes diagnosis in general, because if you go into a primary care physician's office and you describe some emotional problems that you're having, whether or not you meet criteria for a diagnosis of, something like depression or anxiety, that doctor is going to put that diagnosis down in your chart, because without it, he cannot get paid by your insurance for the services that he's providing that day. Hopefully this has provided some good background for you in terms of what is driving medicalization now compared to what was driving it, 50 or 100 years ago.